Hello, hello, hello. I am going to start with an overview of this course so that you will be able to see what's in the course. So when you open your course, it should look something like this pretty purple color. And you will see here the home page, and that's what we're on right now. If I have any special announcements, they will show up here. Then you've got student resources. So if we click on student resources, this is where you will find your syllabus and your outline. And then there is a little tab down here that you have to click once you have read it, saying that you have read and understood it. So let's go over the syllabus and outline. On the syllabus and outline, it's a 3-hour course. It's in the fall. Our online week is going to begin each Wednesday at 8:30 with new content. That means that each Wednesday by 8:30 you have to have your assignments, quizzes, whatever we have due for that week in. I do not accept late assignments, so you want to make sure you don't wait till the last minute to do that, and that you get it done in a timely manner. So make sure you pace yourself. Now I have the first 2 weeks up, but after that I do not have anything, because I post in here pretty much week by week, because I'm always looking for new things. Sometimes things change or evolve or update, so I try to wait until the last second. As far as the my office hours, you will see there that you can contact me via Blackboard at any time during this course, and students needing to meet directly with me can call and schedule an appointment with me. Your required text is Jarvis, Physical Examination and Health Assessment 2016. If you have an older version, you'll be responsible for keeping up with that. As far as the page numbers, everything I give you will be based upon this version. As far as looking at the course description, we are wanting an opportunity here for you to develop and practice your health history taking as well as your physical examination skills, and hopefully be able to improve upon those. We're going to focus on health promotion techniques and clinical assessment tools also of all ages. And then at the end, of course, come up with a comprehensive medical history and physical exam that you will have to successfully do. Prereqs, you have to be have your current current RN license, enrolled in a registered nursing program, or my permission. So if you're in this course without one of these, you need to notify me ASAP. The objectives: we're going to obtain health histories, we're going to execute lifestyle risk factors, we're going to compile health teaching materials for at-risk patients, perform a mental status exam, adapt our techniques for infant, children, and adult, evaluate assessment needs, and then perform a physical exam with appropriate equipment and techniques. As far as the methods we're going to use Blackboard. We're going to be doing a lot of reading. We're going to be doing exercises and assignments, some case scenarios, written assignments, discussion, quizzes, exams, supplemental materials, and a lot of interactive stuff to hopefully help you. New content, again, is going to be presented each week per the course schedule, which is attached. And it allows flexibility in that you have a week to submit your submissions. You are considered absent if you fail to complete or submit a quiz or assignment before the weekly deadline, and again, results in zeros. Unless you've made prior arrangements with me and you know something's come up, I know there are extenuating circumstances, but otherwise you will receive a zero. Look, at this course goes by the standard grading scale, 90 to 100, 80, 70, and 60, so woohoo! Only the final grade will be rounded up or down. All others will just be entered in as accepted. So for this course, you're going to have quizzes and assignments, and tons of them. That's why it's 40%. A comprehensive final exam worth 20%. And the head-to-toe physical examination is 40%. Now, failure to score at least a 70 on your head-to-toe exam is going to result in failure of the course. Comprehensive final exam. The final examination will be delivered online via UACCB Blackboard. Again, it has to be within the allotted time and before the due date. Your head to toe, you're going to bring your own patient. It can be a friend, family member, no children, had to be 18 years or older. They'll be dressed in shorts and a t-shirt or something similar. If they feel more comfortable in a bathing suit, sports bra, and shorts, that's fine as well. You just need to be able to assess all their body regions. We will not be exposing breasts or genitalia. You can record your checkoffs and submit it instead of coming to campus, and we'll go over that when it gets closer to time. I can provide you with some of the necessary equipment if needed, but you would have to sign them out. It will be the student's responsibility to gather equipment when you arrive if you do it on campus. And it's your responsibility if you do it while recording to make sure that you have the correct equipment. Online quizzes are given via the Blackboard. Again, if you don't do it by the due date and time, you'll receive a 0. Learning activities are also outlined weekly in your objectives, and I'll go over that here in just a little bit. Academic inquiry, it goes over some of the stuff that we'll be using, and then our disability support services statement that you need to read over carefully. Also, you will see here the physical exam checkoff guidelines are already given to you, so you know what to expect. You will have 45 minutes to perform this by memory, no note cards, and you will perform this head to toe. It tells you here the guidelines for pass and fail, and I'll go over that closer to the time near the end of the course. I also have outlined for you exactly what you will need to do to pass, and that you can use page 784 and 785 as a guide for your write-up. Again, you'll need to modify it based upon the information below. So we'll go over each one of these sections as we're getting closer, and I will do some videos that go over each section to help you as well. So now we get to our course schedule. Week 1 will be going 8:24 through 8:31. You can see here it tells in the middle what's going to be required and then when your assignments due. So you can see here that introductions are due. Chapter 1 and Chapter 2 you have to read. Evidence-based assessment and cultural competence, cultural care. Anything that's in the objectives for week 1 is going to be due by August 31st at 08:30. And you'll see it can be quizzes and or other learning assignments, and that will vary week to week depending upon what we have going. Right now I have week 1 and week 2's content ready. So up through chapter 5 up through September the 7th, and again after that I will start posting your assignments weekly, and you will get those so you'll be able to catch up. Final comprehensive exam, you can do that between 12/1 and 12/5 at midnight, so you have a span of days there you can pick to do your final exam. We will do our physical assessments between 11/9 and 11/29, so you have some time in there to practice before they're actually due. So we'll pretty much be covering the whole book with the exception of just a couple of chapters this semester, and we hope to keen those skills so that you feel much more comfortable doing head-to-toe assessments. All right, the next section over here is content modules, and if you click on it, it's divided by weeks. You can see here on week 1, there's your introductions, your chapter 1, and your chapter 2. And of course, Mark Twain said the secret of getting ahead is getting started, and sometimes that's the hardest part. So if you click on week 1, you'll see here I'm always going to have your objectives and your assignments. So if you click on it, you will see here that you have to, for week 1, you are going to describe the use of diagnostic reasoning and critical thinking, the use of the nursing process, describe evidence-based assessment, the life cycle, transcultural factors, and the basic characteristics of culture, cultural competence, and cultural assessment. As far as assignments for the first week, there's no quiz or assignment this first week other than discussion questions. And you will have discussion questions posted in the area for the first 2 chapters. He says spend some time reading the chapters and applying the information to your answers. When you respond in the discussion, refer to the book or something you have read. So in other words, include your references. you will be responsible in the discussion post for responding to the original question that I post. And this will be due, it says Sunday at midnight, because I don't want you to wait till the last second and then no one can respond to you. This will allow others to read your posts and respond before the new content is reintroduced on Wednesday morning at 08:30. Then you have to respond to at least one other classmate. It has to be a post that provokes critical thinking and adds something to the post, not just yes, I agree, or boy, that was interesting, or you go, girl. These posts are due by Wednesday at 8:30 when your new content starts. So your original post to your original question has to be by Sunday night at midnight, but your post to other students can be by the deadline of Wednesday at 08:30. Your introduction post, 10 points, woohoo! So there are a total of 30 points available this first week. Easy points. All you have to do is follow the directions and do as it says, and you will get 30 points. All right, so the next is discussion. So if you were to click on discussion, you would see here introductions. And if you click on introductions, then you would just do, and you could click on mine if you click on this introductions here. And you can see here, please tell me a little about yourself, your name, your goals and dreams, your hobbies, and what you hope to gain from taking this class. And then I gave you a little introduction about myself, and you can read it. It says you can do anything you set your mind to, and just remember that. So you can read my introduction, and then you can just continue on by replying. Just hit reply here, and we will all have our introductions in one area. Okay. Other areas in the discussion was our week 1 discussion topics. Of course, these are going to be some of the topics, and you will have your name by them by the time you see this. But right now I don't have names because and not everyone has enrolled, and some may drop, so I want to wait closer to the time that I have a true roster before I assign these actual topics. But it's going to be things like, after reading the chapter, respond to discussion posts as directed in your objectives and assignments. Well, remember, we just read our objectives and assignments, and it said we had to post to the original question by Sunday at midnight. So discuss priority settings as you gather clinical clues to complete an assessment. This will be somebody's. And whoever that is has to post to that by Sunday at midnight. Then they have to post to another student by Wednesday at 8:30 to get full credit. And you can post to more than one if you want. If you see something real interesting or a topic that interests you, by all means, don't feel that you have to only do 2. It is a minimum of 2, but you can post to more. And there's some very interesting topics that we're going to be discussing this first week, so I hope you'll take advantage of that. Just don't forget to resource your original post. Let's see here. Course messages is where you will find, it's like an email. This is another name for email. So this is where the inbox is, and you'll have a message greeting me, with me greeting you here and giving you the link to this video. Also, you'll see here my grades. When you click on it, your grades will pop up, and you'll be able to see where you're at with this course. And then tools will give you some different tools that you can use. And then help is a Blackboard help. So if you have any questions, any concerns about the course, feel free to get in touch with me. Otherwise, let's get started. Hope you enjoy it, and don't hesitate to email me with any questions or concerns that you have. Thank you very much, and have a great day.